Why it is called Kangaroo Mother Care? Kangaroo is an animal found in Australia. She invariably delivers a premature baby, Joey. Joey stays in the pouch of her mother where it gets warmth and exclusive breastfeeding till it matures enough to survive outside. So this technique is similar to kangaroo care, and KMC is a method of care of preterm babies. So in today's video, we are going to learn Kangaroo Mother Care. The learning objective would be background, Bogota Declaration, definitions, component, benefits, eligibility criteria, preparing for KMC procedure, initiation, duration, types, discharge, and follow-up criteria for Kangaroo Mother Care. So starting with the background, of the 20 million low birth weight babies born globally every year, about 8 million are in India. Thus, India has the highest number of preterm births. Over 80% of neonatal deaths occur among small infants, and 65% are due to prematurity and 19% are due to small for gestation age. India has the highest number of neonatal death due to prematurity. Interesting fact is more death occurs outside the health facility, not only in the hospital. Survivors also face life of compromised growth and disabilities including learning, visual and hearing handicap. Care of low birth weight requires special attention, particularly in regards to warmth, feeding, hygiene practice, and KMC had been found to be an effective method of care for these preterms and low birth weight babies. It is called the miracle of 21st century. 2011, an updated Cochrane review assessed 35 studies, and there is now sufficient evidence to recommend KMC as a standard care for all low birth weight babies. It prevents up to half of infant death due to low birth weight, ensures early discharge, it reduces 40% mortality, it has 66% less risk of hypothermia, 61% less risk of nosocomial infection, and it also reduced the readmission rate. The government of India is committed to improving child health by prioritizing newborn care services that increases child survival. In 2014, the Child Health Division of the Ministry of Health and Family Welfare, that is MOHFW, released the national guidelines for KMC in an efforts to implement KMC at facility level. Another document published in 2014 that included KMC was the India Newborn Action Plan, that is INAP. KMC as a specific intervention recommended for small and sick infants weighing less than 2 kgs, and one of the priority actions outlined in the INAP for KMC was the establishment of fully functional KMC unit in health facilities that provide neonatal care services. Reasons why and when it was started and where it was started. The early KMC techniques was first presented by Ray and Martinez in 1983 in Bogota, Colombia. In 1983, large number of weight and preterm were delivered due to poor antenatal care, anemia, pregnancy-induced hypertension, and infection. It resulted in high mortality rate due to shortage of staff and equipment. So, Ray and Martinez developed the KMC as an alternative to inadequate and insufficient incubator care for those preterm newborn infants who has overcome initial problems and required only to be fed and grow. So, they introduced a maternal infant skin-to-skin contact with exclusive breastfeeding as long as infants could feed and were gaining weight. They were discharged regardless of weight. So this practice resulted in improved outcome of low birth weight infants, humanized general care of infants in hospital, reduced hospitalization time and mortality. It resulted in less overcrowding and less abandoned infants, and it also improved staff morale. So what is Kangaroo Mother Care? It is low resource, evidence based, high impact and standardized care. It can prevent up to half of the death in infants weighing less than 2 kg. It is simple method of care of low birth weight infants that includes early and prolonged skin-to-skin contact with mother or substitute caregiver. This fosters well-being and health of newborn by thermal control, breastfeeding, prevention of infection, facilitate bonding. It can also result in early discharge and better outcome. There are 3 components of Kangaroo Mother Care: Kangaroo Position, Kangaroo Nutrition, and Kangaroo Discharge and Follow-up. In Kangaroo Position, baby is placed between mother's breast in an upright position. Head is turned to one side and in slightly upturned position. This position helps in breathing and also allows eye-to-eye contact between mother and baby. It improves cardiorespiratory stability, oxygenation, and lung volume. This position reduces the apnea, bradycardia, and poor oxygenation. Kangaroo position or skin-to-skin contact is an effective method for thermoregulation, is as efficient as incubator to maintain the adequate temperature. It reduces the risk of hypothermia and it can be safely practiced till the baby is able to maintain its own temperature. Kangaroo nutrition Breast milk is the food of choice for all babies. Having all babies on KMC immediately and exclusively breastfed on demand. Feed babies who are not able to suck frequently with expressed breast milk initially by cup and spoon and or by nasogastric tube. While the suckling reflex is emerging, supplement these feeding methods by non-nutritive sucking, that is putting the baby on mother's empty breast will effectively stimulate suckling reflex. And once the baby is suckling well, baby should be exclusively breastfed. Kangaroo nutrition promotes lactation, it facilitates feeding, and it also provides adequate nutrition to the baby. Desired weight gain because of KMC helps in early discharge. Regular follow-up care to identify problems for early intervention. So these are three components of Kangaroo Mother Care. So what are the benefits of Kangaroo Mother Care? Benefits to mother, infants and hospital. Mother also benefit from engaging in the practice. Data showed that when KMC is practiced, the parents are empowered as a primary caregiver of their child and encouraged to protect and nurture their infants. Breastfeeding rates are increased. Time spent in the NICU is reduced. Family bonding is strengthened and attachment between parents and infants deepens. Stress levels are lower. Parents become less likely to develop mental health issues like depression. Parents become more confident and competent in their role. Health outcomes of newborns are significantly improved as KMC leads to improved growth, weight gain, motor development, improved sleep patterns, and sensory development. It reduced mortality rates, reduced the rate of infection and sepsis, fewer cases of hypothermia, as well as improved temperature management capabilities. KMC allow a multisensory stimulation, olfactory, auditory, tactile, sensitive, and proprioception that allows this immature baby's brain to grow and connect in the best available condition. Auditory stimulation from the parent's voice and natural sounds of breathing and heartbeat. Touched by skin of the parents. Olfactory stimulation by smell of the mother and breast milk. Visual stimulation by the sight of mother. All these stimulations is very important for the baby's development. It improves the gastrointestinal function, higher initiation and duration of the breastfeeding, and protect against the infection. It is also a valuable measure in pain management as direct skin to skin contact and breastfeeding has been shown to lower pain level in infant, thus actively protecting brain development. So studies showed that all painful procedures like putting an IV line, removal of adhesive tape, giving IM injections, ROP check should be done while baby is receiving KMC. It also demonstrated in one of the review article of Acta Pediatrica that there is a strong direct evidence that kangaroo position prevents incidence of severity of apnea of prematurity. Though these babies have less episodes of apnea than those in incubators. KMC in a stable infant maintains and improves the vital parameters. Several authors have studied impact of KMC on physiological stability of preterms, analyzing heart rate, vagal tone, respiratory rate, oxygen saturation, desaturation episodes, cerebral oxygenation, and other indicators. Their study conclude that regardless of heterogeneous condition of prematurity, preterms and low birth weight babies, KMC maintains and improves the physiological stability of low birth weight babies. Introduction of KMC leads to measurable reduction in cost and lower capital investment as no expensive and fancy equipments are needed and hospital stays tend to be shorter. KMC also facilitate respectful maternal and newborn care. In addition, the infant requires less handling by medical staff, which also frees up the staff resources. It also reduces the readmission rate and biomedical waste. So what are the eligibility criteria for Kangaroo Mother Care? In our country, it is started for the babies who are weighing less than 2000 grams. Ideally, KMC should be started in all babies weighing less than 2.5 kg. In our country, newborn weighing less than 2 kgs should be started on KMC on priority in view of the high burden of low birth weight babies. Babies weighing less than 1800 grams should be hemodynamically stable to receive KMC. The babies who are on oxygen and tube feeding can receive the KMC if they are hemodynamically stable. Mother should be willing, should be in a good healthy condition, should maintain proper hygiene, and she should be supported by family. Any member can do Kangaroo Mother Care, and that's why it is renamed as a Kangaroo Family Care. So how do we prepare a mother or a family for Kangaroo Mother Care? Explain the concept of KMC to mother and demonstrate how it is done. Explain the benefit of KMC. Integrate family members depending on cultural setup. Help the mothers with any problem related to positioning, feeding and care of the newborn. Discuss with the mothers about any problems they may have. Consistently encourage them to continue KMC. Provide health education messages. Raise awareness to sensitize families and communities about KMC. What should mother wear? Any front open light dress as per local culture, gown, blouse or sari will work. The baby should be wearing a front open shirt with nappy, mittens, socks and caps. Kangaroo Mother Care procedure. There are 4 parts of KMC procedure: kangaroo positioning, monitoring, feeding and privacy. Dress the baby appropriately with socks, nappy, cap. Place the baby on the mother's chest with binder. Put a blanket or shawl on the top of for additional warmth. Support the baby's bottom. Head should be turned to one side in a frog-like position. So place the baby in between the mother's breast in upright position. Head turned to one side and slightly extended. Hips should be flexed. Support binders. Tie the binder firmly enough that the baby will not slide out. Make sure that the tight part of the cloth is across the baby's chest. Baby's abdomen should not be constricted. Baby should have enough room for abdominal breathing. So mother and the staff should see neck positioning neither too flexed nor too extended, as it can cause apneas. Color and temperature of the baby to note the episode of hypothermia or a cyanosis and to act immediately. Health and feet of the baby for the warmth. Regular breathing as the baby's abdomen is in skin contact with the mother. Mother can feel the breathing movements of the baby and the baby's airway should be clear. Feeding. Help mother breastfeed her babies. Holding baby near to the breast will stimulate the lactation. Privacy. It requires some exposure on mother's part. So privacy should be maintained to avoid discomfort and anxiety in mother. So when and how to initiate KMC? KMC should be started as soon as possible once the baby is stable. KMC, short sessions of KMC can be initiated even if the baby is receiving IV fluid, oxygen therapy and gavage feeding. Duration of the KMC. It is called short duration when it is 4 hours, long duration when it is of 5 to 8 hours, extended when it extends more than 9 but less than 12. It is called continuous KMC when it is more than 12 hours. Each session should be of at least 90 minutes. Effective 60-minute sleep cycles can be received for better neurodevelopmental outcome. Types of KMC: interrupted or continue. Interrupted KMC are for the small infants who need warmer care as well as frequent monitoring, who are on the oxygen therapy. Here the time period can vary, it depends on the condition of the baby and mother. While continue KMC can be given both during day and night, hospital and home. Tremendous family support is required and it is ideal for low birth weight babies. When to discontinue KMC? Post-conceptional age of 40 weeks. When the baby reaches the weight of 2.5 kg, baby is uncomfortable in KMC, wriggling out, pulls the limb out or cries vigorously at all the attempt of putting baby in KMC, it means it is time to stop KMC. Discharge criteria: baby should be well with no infection, feeding well, gaining weight of 15 to 20 mg per kg per day in last 4 days. Baby should be having no episodes of hypothermia before the discharge for at least 3 days. Mother should be confident enough to take care of the baby and follow-up visits are all ensured. Post-discharge follow-up, it depends on the NICU protocol, NICU protocol, but generally once or twice till the baby reaches 37 weeks or the weight of 2.5 to 3 kg weight. Thereafter once in 2 to 4 weeks till the age of 3 months of post-conceptional age. Subsequently every 1 to 2 months during the first year or at the time of immunization. More frequently if baby is not growing well. WHO also recommended KMC during the COVID-19 pandemic. Think KMC, believe KMC and practice KMC. In fact, it is indeed a miracle of 21st century for the care of all preterm and low birth weight babies, especially in developing countries. Thank you very much for watching this video on Kangaroo Mother. I hope you all learned and understood well. Please share, like and comment.